Hello, my name is Made Caryn Dwi I. Student number 191313050. I will to tell you my favorite device. The first is USG or ultrasound. Second is infusion pump, and the third is EKG or electrocardiogram. Why I like the device? Because all the device can help people if they are sick, and the device is important. Ultrasound or USG is a sophisticated tool that has ever existed in the medical world, where this tool has a technique that can produce image from within a person's body. The image produced from these sophisticated tools come from sound waves with very high frequency. A device known as a transducer, when attached to the human body, will produce high frequency sound waves. Then its echo that reflects will form an image of the size, shape, and consistency of the soft tissues or organs in the body. How ultrasound works? Ultrasound works by emitting ultrasound waves through a transducer with a gel intermediate medium. Then the ultrasound waves will be reflected back in the form of an image on a monitor screen, so that we can see our internal organs on the monitor and can immediately find out what abnormalities have occurred. The use of ultrasound waves in medicine was first performed in 1942 to diagnose brain tumors. How to use ultrasound procedure? Most ultrasound procedures will take 15 to 55 minutes, depending on the type of ultrasound and the body part that needs to be examined. The examination procedure will also be carried out according to the type of ultrasound used. External ultrasound. The patient will lie on the bed and the doctor will apply a latex lubricating gel to the area to be examined to facilitate movement of the probe. The patient will feel a cold sensation in this process. The patient may feel pain or discomfort when the body part is placed. Tell your doctor if pain gets worse. For those who will perform a pregnancy ultrasound test, the doctor will move the probe over the lubricated skin and see the condition of the fetus through a monitor that is placed next to the patient bed. The patient can see the condition and hear the fetal pulse sound directly. For ultrasound of the baby's head, the probe will be moved at the ground that has not closed. Capture image of the brain and the room that contains brain fluid will be seen through a live monitor. For adult head ultrasound, it can only be performed during head surgery when the skull has been opened, because the sound waves from the probe cannot pass through the bone. Infusion pump. The infusion pump is a medical device that functions to help the infusion process or inserting fluids into the patient's body with a certain time and amount. The infusion pump has two components in it, namely electronic component and mechanical component. Why is that? Because this tool works on the infusion tube. It acts as a regulator of the number of droplets in accordance with the wishes that we input on an electronic microcomputer control system. How to work and use? The work system or work process of this tool starts from installing the hose on the clamp contained in the infusion pump mechanics, so that the hose is squeezed by the peristaltic finger. Settings are input via the control panel to obtain the drops according to the doctor's therapy prescription. The serration in the mechanical system moves peristaltic pressing the hose and pushing it down so that the intravenous fluid flows. The function of the EKG or electrocardiogram. The function of the EKG itself is to record all heart activity, be it normal or abnormal activity, then detect the presence of heart disease, electrolyte disorders such as hyperkalemia or hypokalemia, and can also detect non-cardiac disease such as hypothermia. All of that can be detected by the EKG tool by using the EKG to the patient, then starting to run the EKG machine. Let the device work for a few minutes, then print the patient, record their heart activity, and the cardiologist immediately reads the graph on the paper and explain to the patient how the condition is his heart. Procedure: the EKG will work correctly and accurately if the lead cables on the EKG cable are correct and accurate. Maybe you can see in the picture below for the position of placing the leads EKG. C1, C2, C3, C4, C5, RA, RL, LA, LL correctly and precisely. How to use? Number one, adjust the patient position. The patient position is set flat supine to open and loosen the upper patient clothing. If the patient wears a watch, bracelet, other metal to be removed. 3. Clean the dirt using a cotton swab on the chest area, both wrists and both legs where the electrode cuffs are located. 4. Put jelly on the electrode surface. 5. Attach electrode cuffs to both wrists and legs. 6. Installing electrodes around the heart. 7. Turns on the electrocardiogram monitor. And the last number 8. Connect electrocardiogram cables to both limbs of the wrist and both legs of the patient ankle for the recording of the limb leads. Lead 1, 2, 3, AVR, AVL, AVF by red color on the right wrist, green on the left leg, black on the right leg, yellow on the left wrist, then put on chest electrodes for precardial lead recording. Thank you.